Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Pravahika and I put in front of you my views about the Samprati of Pravahika and I try to explain between the lines of the Samprati which is mentioned in the text. We have also seen why the curve doesn't get adherent to the Grahani and directly comes to the Pakvashay, and I will appreciate your views about the topic which I have mentioned in last lecture. So after Samprapti is complete, the situation is the Kleda curve has been dragged into Pakvashay and it has been adherent to the Rokshata of Vata dosh to the intestinal walls, mainly large intestine walls, and this adherent cover becomes sthana. This sthana cover, the intestines try to expel it out, and in that reaction, there is again Vata Prakop, there is again Ruksha Guna Vruddhi, there is further or more sthanata to this adherent curve, and it gets stick to the intestines more and more. So this vicious cycle goes on. Sthanata, forceful expellation by the intestines. In that reaction, again Vata Prakop, Rukshaguna Vruddhi. This Rukshata makes more this Sthanaka more adherent, and cycle goes, and a situation comes where the Kapha Nistaranit is the word mentioned by the Granthakar as a symptom of Pravahika. So, in Chikitsa, to break down this vicious cycle, all of us know the best guna is a Pichila guna because it will take care of Ruksha guna of Vata dosh, as well as these adherent Sthana Kapha will also get loosened from the intestinal walls. So, the most famous dravya which we all know is Mocharasa, and this Mocharasa dravya, which is Pichilina guna, has a good effect to reduce both this, to take care of both this factor of Ruksha guna of Vata dosh and Sthana Kapha, which is adherent to the large intestines. Now, what is the famous Panchayama Chikitsa? It is also, you must be knowing, it is a Pichabasti of Mocharasa, and as it is the Samprapti has happened in the Pakvashay, the nearest route to reach this Sthana Kapha is Basti Marga. So Mocharasa Pichabasti is a famous Chikitsa, all of us know, there is no need to explain. The practical problem when all this happen, that this Samprapti is going for months, and Pichavasti, yes, it is ideologically the best treatment, all of us know, but the practical problem comes that many a times patient doesn't have so much of time or to take Basti for a longer time, maybe by job or by distance, by any way. So Mocharas Pichavasti, ideal one, but how to make solution if a patient is not able to take Pichavasti for a longer period, because Pravahika is a very chronic disease and it will take time to cure, so more number of Pichavasti are required. So what is the solution? Today's topic is this clinical approach, how to take away if Pichavasti is not possible to the patient. Now, the other route remains is the oral route, no doubt about it. If a patient is saying that, okay, Pichavasti is not possible, give the medicines. At what time you will give these medicines and which one? As I said, Pichila Gunatma Dravya like Mocharasa or even Isabgol like Dravya are useful. many a times the Pichil guna is very as compared to the other guna is rare in the availability wise in the Ravyas. As we say the Gurvadi guna, there is no Pichil guna in the Ashtavidha Virya. So in that case, Snigdha guna is also helpful. So Snigdha Dravyas, any like even Ahare Dravyas are more available like Dugdha, Gruta, black grapes, Kharjura, ityadi. So Pichil Dravya you can use ideologically, no doubt, but in addition, the Snigdha any Dravya are also useful for the Basti also as well as to the oral route also. And what time will be the ideal timing to have a fast and good effect? Now Samprati is in the Pakvasha region. It comes under the Apanvayu Kal, Apanvayu Kshetra, and the Aushadha Sevan Kal for Apanvayu is Annado Vigune Apane. So the drugs or medicines to be given of Snigdha Guna or Pichila Guna before the meals. Now, many a times it is taken that Annado Vigune Apane. In practice, some Vaidyas take this as a before lunch and before dinner. It is nothing wrong in that. And why that is that Kal is specific for Apanvayu? Because the first medicine is taken, it reaches to the Pakvasha before food, and that medicine will act on Apanvayu, the medicines will make the Apanvayu correct, and the following food and then other karma of Apanvayu like Malla, Ishtamana, etc. will be normal. This is the logic. I am going to take a lecture on Aushadha Sevan Kal and the logic behind the Aushadha Sevan Kal separately. So, in that case, Annado Vigune Apane, it means before lunch and before dinner, no doubt. But in my practice, as the Pravika is a very chronic disease, takes more time to cure. Every Annada Kal, breakfast, lunch, dinner, or even evening snacks, let's say 5 a.m. to 6 p.m., I take it as a Annado Kal, and I ask the patient to take the medicines before any type of food, breakfast, lunch, evening snacks, or dinner. It helps to cure the patient more quickly because patient is already frustrated by this chronic disease, and that's why you have to give medicines more times in and more matra also. So Mocharas Piksha Basti, ideal one. If not possible practically every time, then Snigdha Pichila Dravya before any type of food are best result giving drugs or time. Now, how much time before the food? It is not mentioned in the text that 5 minutes, 10 minutes, or any other way. Generally, I prefer to give these medicines half an hour before any type of food because it gives more time for the medicines to get digest, to act on the pakvasha and on the that saman apanvayu, and to have interaction with the sthana kapha also. So this is the topic of the lecture today, that Pravayika, everyone know the treatment, standard treatment, but at what time it will give best results was today's aim of the topic. So we will meet after 15 days with the new lecture. Thank you very much.